Thank you, Babajide. Mass community testing is set to be crucial to the COVID-19 response. Experts say governments must test a large percentage of their populations to fight the coronavirus. But what steps can Nigeria take to roll out testing? And that's on a large scale. Dr. Bidemi Awodele, a public health physician, joins us here in Lagos. Welcome to the program.
Thank you for having me.
So how do we build a pipeline of testing capacity with what we've been told are limited resource?
It's a tough one. With COVID-19, nothing really is jacketed. And as we go on, we move, we see what is going on, and then learning from others around us. But with the testing, I would want to say Lagos State actually blazed the trail by testing, decentralizing the testing, and collecting samples from the 20 local governments. However, that is not enough. And so we have to think out of the box. There's so many things going on now. However, for the rapid testing kits, we need to look at it carefully so we don't run into troubles. There are so many test kits. One click of the computer, you can see all sorts of things. RDTs claiming you can get your test in as much as 10, 15 minutes.
Yeah, like what we heard from the Kogi government.
For quality control. And then we need to get a test that will be very, very sensitive. And what I mean by sensitive is that a test actually showing the virus is there. So we don't have a lot of false positive, because if we have false positive, it's going to take us back in the fight against COVID-19.
If we look at the country's epidemiological report, you've said Lagos is a trailblazer, but for other states, which would you say is next in line to Lagos?
That's a tough one. That's a tough one. But I think initially in the fight against COVID-19, the FCT was also churning out results. But now, when you put on the TV, you see all those results coming in. So I think with time, using Lagos State as a yardstick, most of these states are ramping up their testing capacity. But that is not to say even Lagos State cannot do better. And so that is in the pipeline. If Lagos State, seeing what we have now, we're about 20 million. So 20 local government sites, testing collection sites, and then NIMA and IDH is not enough. And so we need to think out of the box.
Exactly. And some people are saying, let's, more innovative solutions, homegrown. But can there be such examples when it comes to testing? And if we're planning to, or sticking with the reliable mode of testing,
yes, why
which
not?
is the RT-PCR?
Why not? Initially in the testing, regarding that testing collection of samples, the VTMs, the viral transport media, we started thinking of what to do, and we were able to get something homegrown, and works as fine. And so it just depends on, also I would also chip in this, we may also need to think out of the box, like I actually said, regarding the private people, we may need to bring them on board. There are a couple of world-class laboratories, because going forward, it's looking like COVID-19 is not going to end anytime soon. And so we need to sit down together, public, private, try and brainstorm to tackle this menace.
All right, we appreciate your time. Dr. Bidemi Awodele, a public health physician. Thank you for joining us.
Thank you.